How we go about diagnosing this is several ways. Doctor, I wanted to first talk about the first one, which is the barium swallow test. What is that?
Well, before we get to that, I would say that most pediatricians are able to make the diagnosis without any testing whatsoever, just based on the history. And we only really engage in testing once we're thinking about sort of increasing our level of intervention. So for most babies that come in with just symptoms of reflux, the pediatrician would probably start treatment without doing any testing. So he may thicken the feeds, lower the volume of the feeding, do different things to try to get the reflux under control, even try some medication, change the formula. But if those things are not working and the baby's still having problems, then yeah, then we need to like move it up a step. And that's when we might get something like a barium swallow, which will, it basically gives us a map of the esophagus and the stomach and lets us know that there's no kind of obstruction anywhere that would cause the baby to throw up.
There's another one that's the pH probe. What's that, doctor?
The pH probe is kind of like the gold standard for diagnosing reflux disease, and that is a probe gets placed from the nose into the esophagus, and that probe will measure the pH, like you measure the pH in your pool, right, to see what the acid-base balance is. And if there's acid in the esophagus, then that acid is coming from the stomach, which means that the baby is having reflux. And there are different standards that they use to designate whether it's pathologic or not, whether it's something that is abnormal. We all reflux during the day. So a normal adult will reflux 6 to 10 times a day. And obviously, the smaller you are, the more likely you're going to reflux. But it needs to meet a certain criteria of number of events and number of acid in the esophagus for us to designate it as gastroesophageal reflux disease.